The next bill on the calendar for the day is Senate File 2539. The clerk will report the bill.
Senate File number 2539, number 4 on the calendar for the day, an act relating to human services.
The gentleman from Rock, Representative Schumacher, Chairman.
Thank you, Mr. Speaker. Members, the bill in front of us recodes the nursing home statute that we have in the state so that we can better organize and have this under a new, clean chapter of law. You may remember last year we had the value-based reimbursement system, which provided for generational change to the way that we provide funding for our nursing homes in the state. And we found in that process that it was time to clean up the books when it came to our nursing home statutes. We had in that process found that some of the older systems were still in statute but hadn't been used in over 3 decades. And so it was time to clean things up and make it a little bit more easier for people to understand and actually read and be able to follow what the statutes have. The bill in front of us, what we'll be voting on in a few minutes, contains no policy changes, and the only verbiage changes that come along with this are in the definitions area, and that was only to make definitions consistent when they would go through statute and they weren't consistent. This, members, was about a 6-month-long process that the heavy lifting was done for by the House Research Department, and I have a lot of thanks for them for their dedicated efforts to this. They worked with the Revisor's Office, with DHS, and as well as the industry to put together the bill before us today. Again, a 6-month process to get this all done. And so, members, I would ask for a green vote.
There is an amendment at the desk. The clerk will report the amendment.
Murphy E. moves to amend Senate File number 2539, and the amendment is coded A1.
The lady from Ramsey, Representative Murphy E.
Thank you, Mr. Speaker, and thanks again for calling me a lady. I appreciate it. Members, the A1 amendment is, again, legislation that I've introduced, an amendment that we have seen on the floor already dealing with birth control and allowing pharmacies to dispense a full year of oral birth control for patients who have a prescription and after their first 3-month supply has been used. And I would ask for your support. And I would ask for a roll call, please.
Roll call having been requested. Are there 15 hands? Seeing 15 hands, there will be a roll call. Discussion. Or excuse me, Representative, did you have any more right now? Okay. Discussion. The gentleman from Rock, Representative Schumacher.
Thank you, Mr. Speaker and members. And when I saw this amendment come up, working in the nursing home area as I have for a long time and worried about what our seniors and their caregivers are facing, to see an amendment dealing with contraception, really it caught my interest. So I had to look into it just a little bit further. And I learned a couple of things about this within the process. First, when you Google STD and nursing homes, you don't click the image search on that one. That's a little bit tough. But the other thing I learned is that there is actually a growing issue when it comes to the need for contraception in nursing homes. Just last October, there was an article in the magazine Governing, which we all get at our homes, talking about the rise of sexually transmitted diseases within our nursing homes and elderly communities. They found that the rise of chlamydia, in fact, has raised by over 31%, syphilis by 52% in our nursing homes and amongst our seniors. And they actually found that it's easier to contract STDs because of the lower immune systems that our aging population has, and that it's harder for doctors to detect what these sexually transmitted diseases may be showing up as because of the worsening eyesight, the arthritis. Those things could have been caused by gonorrhea, or it could just be part of the natural aging process. And so I've been learning a lot in that area as well. I've also learned that only about 13% of nursing homes ever provide any kind of sexually transmitted disease training for their staff and for their seniors there. And so this is a growing issue, and it's one that people are not really willing to talk to and talk about. But as we're debating this today, And looking at this, I don't think we're really having to deal with the issue of pregnancy in our nursing homes, but there is the need to discuss contraception in the nursing homes. But when we look at that, and we look at the amendment that we have before us, the U.S. Department of Health actually says that in cases like this, that condoms are the only reason and the only contraception method that can be used in order to reduce the chance of contracting a sexually transmitted infection or a sexually transmitted disease. And so with that, I think that if we want to work on this issue, especially for our seniors and for their caregivers, that we should be focusing on the use of condoms for our seniors if they're going to be doing that, so we don't have the rise in chlamydia and gonorrhea, and would stand with the Department of Health on this and would urge you to vote no on the amendment as it doesn't reach the real effect of what we want to do here.
Mr. Speaker.
Discussion.
Mr. Speaker, point of
Jennifer
order.
Morrison to the amendment. Representative Kresha.
Mr. Speaker, members, after hearing that, I think I absolutely have to stand on a point of order. And in looking over the Schumacher bill, I don't see anything in here that deals with contraceptives. And again, after his speech, I'm going to rise to a point of 3.21 germaneness, Mr. Speaker.
Representative Kresha rises to a point of order under Rule 3.21 or 1.2.21. Advice to the Speaker. The lady from Ramsey, Representative Murphy E.
Thank you, Mr. Speaker and members. And the rule of germaneness under this majority is stretchy, to say the least. It is a moving target. 256, statutory alignment is clear. And I appreciate Representative Schumacher's review of contraception in nursing homes. A fun fact that he missed is that the increase of young people being served in our nursing homes is increasing by 14%. So by 14%, the age range of someone from age 31 to age 64, that is the age range of young people being served in nursing homes across this country, including in Minnesota. You know, before I was a nurse, I was a nursing assistant, and I worked in a nursing home and did take care of somebody who was probably about 25 years old in a nursing home. So to think that our nursing homes are only serving senior citizens is inaccurate. To think about contraception only as birth control is also inaccurate. Birth control is a medication that's used for many treatments, for men and for women, for treatment of cancer, among other things. And I think that it's important for us to talk about why this legislation that I am amending to your bill is critical for people all across the state of Minnesota, and that is why I'm bringing it. It is about making sure people have access for a full year to the medication that they need. It offers a level of course, convenience for women and men who use this prescription, but it also means that their treatment is seamless. And we have mutuality in that goal, especially around the idea of preventing unintended pregnancies. In the states that have passed this legislation, they have seen a decrease by 30% of unintended pregnancy. So, yes, we're talking about your nursing facility bill today. Nursing facilities in the state of Minnesota and across the country serve people, not just senior citizens, but young people. They use contraception not only for that reason, but for other reasons as well. That's why I think this is germane, and I'd ask for your support. Thank you, Mr. Speaker.
Advice to the Speaker. The gentleman from Hennepin, Representative Thiessen.
Thank you, Mr. Speaker. Well, I would just draw the Speaker's attention to page 56, which specifically refers to section 256B.0625, and the amendment that Representative Murphy is offering amends 256B.0625. The exact same section is in the body of the bill and in the amendment that she is offering. And so I just don't know how you can't find this to be germane, Mr. Speaker.
Advice. Representative Anderson S.
Thank you, Mr. Speaker. I'd like to give advice. On the point of order, when you look at the bill, it is just adding a section to 256B.025. What she is doing is she is amending section 256B.0625, subdivision 13, which the bill does not get into. Therefore, this amendment is not germane.
Advice to the Speaker. gentleman from Ramsey, Representative Pinto.
Thank you, Mr. Speaker. Mr. Speaker, just responding to the point of Representative Anderson. 256B.0625 describes covered services. The bill adds a particular covered service. The amendment proposed revisions related to covered services. It's all connected, and I think that the comments of the bill's author, who may disagree with what the amendment is trying to do, but acknowledging there is in fact a connection here. Mr. Speaker, as the minority leader said, I don't know how you could possibly find this point of order not well taken. I urge you to find it well taken. Thank you.
Advice to the Speaker.
Or the other way around.
The lady from Hennepin, Majority Leader Pepin.
Thank you, Mr. Speaker. Mr. Speaker, I'd like to offer advice.
Advice.
Mr. Speaker, my advice is that I think that you should take this point of order as well taken. This amendment largely expands the scope of the bill, and historically, we have not allowed amendments to greatly expand the scope of the bill historically since the time I've been here, and so I would ask you to take the point of order well taken.
Advice to the Speaker. After receiving advice from various members, the Speaker finds that the point of order is well taken. There are no further amendments at the desk. The clerk will give the bill's third reading.
Third reading, Senate File number 2539.
Third reading. Discussion to the bill. The clerk will take the roll on the bill. The clerk will close the roll. There being 130 ayes and 0 nays, the bill is passed and its title agreed to.